Good morning. I will be discussing about the management of Mr. David Nazar, a 62-year-old man with a significant exacerbation of chronic obstructive pulmonary disease, COPD. Within this presentation, I will discuss about the ATE assessment as well as the relevant diagnostic result and vital nursing interventions in order to assist COPD patients such as Mr. Nazar. In patients having acute exacerbations of COPD like Mr. Nazar, a strategy known as the ATE method is employed to identify and manage potential fatal conditions. Keeping the airway patent is essential to avoiding hypoxia. Airway narrowing and mucus development are common consequences of COPD exacerbations, making it essential for Mr. Nazar's airway to remain open to ensure optimal airflow. In order to maximize airway patency, clinical procedures including suctioning and positioning might be used. The breathing evaluation of Mr. Nazar indicated an elevated respiratory rate of 30 breaths per minute, according to the Emergency Care Institution, New South Wales 2022. He also had an increased dyspnea and a lower oxygen saturation of 78% on room air. These findings suggest respiratory distress and hindered gas exchange. Administering therapy to maintain the different range of oxygen saturation from 88% to 92% within COPD patients like Mr. Nazar will elevate hypoxia while preventing hypercapnia, a risk in COPD patients. A further strategy to lessen breathing effort and carbon dioxide retention is non-invasive ventilation. Blood pressure, heart rate, and peripheral perfusion must be monitored in order to elevate circulation. In Mr. Nazar's case, compulsory tachycardia due to hypoxemia and underlying hypertension are suggested by his elevated heart rate of 128 beats per minute and blood pressure of 168 over 85. These conditions increase the workload on the cardiovascular system during a COPD exacerbation, according to the Chronic Obstructive Pulmonary Disease Clinical Priorities 2020. The early diagnosis of hypertensive crisis or circulatory collapse requires routine monitoring of a certain vital signs. The neurological status of the patient is evaluated in the disability component. The fact that Mr. Nazar is attentive is encouraging, but lethargy or disorientation may be an indication of hypercapnia or deteriorating respiratory failure. His Glasgow Coma Scale score of 14 out of 15 clearly showed this. However, routine evaluation with this GCS will assist in tracking any decline. Finally, exposure includes evaluating the patient's overall appearance, skin integrity, and temperature. For Mr. Nazar, assessing the cyanosis such as his IV cannula and using appropriate coverings to maintain body temperature can prevent complications like hypothermia. For Mr. Nazar, various high-priority interventions are required to stabilize his condition and promote efficient recovery. Controlled oxygen therapy is significantly necessary to prevent hypoxia, which could exacerbate CO2 retention in patients with COPD, and to keep oxygen saturation within the target range of 88% to 92%. Furthermore, since this intervention is non-invasive and non-pharmacological, it is highly advantageous for individuals with COPD such as Mr. Nazar. It directly lowers hypoxia and stops the respiratory function from further deteriorating. Furthermore, bronchodilators such as salbutamol and ipratropium should be administered through nebulization to relieve bronchoconstriction, improve airflow, and enhance oxygenation. According to COPD exudations, management, and hospital discharge. These drugs aid in relaxing the smooth muscles of the airway, enhancing Mr. Nazal's breathing. The admission of corticosteroids like prednisolone reduces airway inflammation and exudation severity, preventing further deterioration of respiratory function. A short course of oral prednisolone would stabilize Mr. Nazal's inflammation and reduce the risk of recurrent exudations. Given the likelihood of bacterial infection contributing to Mr. Nazal's exudations, antibiotics such as Given the likelihood of bacterial infection contributing to Mr. Nazal's exudation, antibiotics such as erythromycin are recommended to treat underlying infections and reduce exudation frequency. Moreover, timely administration of antibiotics has shown to improve patient outcomes and reduce hospital stays. Since hypoxia drives respiratory effort in COPD patients, like Mr. Nazal, careful titration of oxygen is essential to prevent CO2 retention. Continuous oxygen saturation monitoring and adjusting oxygen flow are essential to prevent hypocapnia. These bronchodilators, such as salbutamol and ipratropium, should be administered through the use of a nebulizer or a metered dose inhaler with a spacer. Frequent assessment of respiratory rate and lung auscultation should follow administration to monitor the effectiveness. Patients must also observe for side effects such as tachycardia and dry mouth. To effectively manage exudations, oral corticosteroids such as prednisolone, especially individuals like Mr. Nazar, require regular monitoring for hyperglycemia and accompanying adverse effects. Patients with COPD may require routine blood glucose tests as they are more likely to experience steroid-induced hypoglycemia. Given that azithromycin is an oral antibiotic, it's critical to monitor for potential side effects such as QT prolongation and gastrointestinal upset. As with Mr. Nazal, prompt antibiotic treatment can prevent the progression of respiratory infection and minimize the severity of exacerbation. In addition, antiviral drugs like nirmatrelvir and ritonavir are mostly recommended to treat COVID-19. However, if a coexisting viral infection is present, they may also be prescribed to COPD patients like Mr. Nazal. It is imperative to closely monitor for drug interactions, particularly while taking other drugs that are metabolized by the liver. In conclusion, an extensive assessment ranging from A to E should to be conducted in order to effectively manage Mr. Nazal's COPD exudations. It is recommended that oxygenation, bronchodilation, inflammation control, and infection management be given top priority. These evidence-based treatment could help patients like Mr. Nazal heal more quickly, prevent more issues, and maximize his capacity for breathing. In order to preserve the highest level of care, each medication and intervention must be carefully evaluated, taking into account the patient's unique characteristics, administration techniques, and potential side effects as well. Thank you.